I'm just going to start with a question for you, and I've got a few questions for other panel members. So I hope we can get through most of them. But you were a medical director, Nadeem, and what was it like being on the receiving end of people plans? And what would have made a difference, do you think, when you were in that role? What were your views in terms of how people could be more effective and using their time better? You're muted, Nadeem.
And there you go. So thank you. So I suppose, I mean, I'm not trying to be unkind, but it struck me that the people plan was a plan that came out of an executive team that was part of the executive team, but a sort of silo approach. So it was a silo piece of work. It was a product that came out of the HR director's office and team, and it was landed there that then required us to then think and engage about it. My question was, why this surely is something that we should have all contributed to right from the beginning rather than after the fact. That was my first observation. Second was that the plans of my time, which isn't that long ago, to be fair, were very much about focusing on discipline requirements, so doctors, nurses, recruitment vacancies, and then there was a focus on what do we do about the illness rates and the sickness rates in the organization. So the dials were long-standing, and I couldn't see what was in the plan that would have shifted the dials particularly. It was just working harder to do more of the same, more and more of it. And I guess the final bit was there certainly wasn't anything about understanding needs. It was a skills requirement for the organization that needed filling, not the needs of the staff that needed to be part of that plan and understanding. So skills, yeah, I need more orthopedic surgeons, I need more admin, but actually what about the actual needs of people? But then for me, the real gel was, but these people work in teams. So how do we then think through the idea of connecting needs across so that teams are really successful and able to do their job optimally, rather than thinking about the silos of disciplines that sat in the people plan. So I think there's a phenomenal opportunity with learning to think differently as we've described it, thinking about the individual needs, but then pulling that up to how these teams work really well, and then understanding what we do to maintain that prevention approach that makes them not fall into difficulty, not fall into distress. But that requires that understanding of needs, wants, behaviors, and motivation. So that's my view, and I'm excited that Alder Hey and now Liverpool Foundation Trust are taking that really unique approach.
Thank you very much indeed. Okay, well, let me go back to you, Naeem. There's a question for you. Why do you think organisations and leaders find it hard to think differently? I'm interested in your answer.
Thank you, Dame Jo. It's not an easy question to answer. I think it's just comes down to number of things. One, I think it's the constant pressure from above in terms of the requirements which we have to kind of fulfill day to day. And then there is the complexity of accountability and decision making within an organization. And what often becomes clear is when we find it difficult to address a particular issue, we go back to default behaviors, default responses. But I think what it requires is strong leadership. It requires at the top, where we find boards, chairs, chief executives, and all the C-level, and as we found in Alder Hey and Liverpool, requires a commitment to say, right, okay, we're not going to be able to solve all the problems. We're not going to be able to boil all the ocean. Things are going to take some time to get better, but let's just allow ourselves the headroom amongst all the chaos which is happening around us to stop, pause, and think, allow ourselves to think. I think when we start shifting the focus from activities, functions, services, divisions to people, i.e. from a consumer lens, who the people walk to the door, what they're coming in for, how we respond to them, but also in terms of staff, as we discussed in this conversation, it becomes a lot easier to understand what are the things that we need to do, what are the things that are having an impact, and what does that mean in terms of things we need to do. I think the other thing which really comes helps in terms of enabling organizations to think differently is data. there's a lot of data across the NHS. There's no shortage of data at all. The point is, are we asking the right questions? And are we bringing our cognitive biases into the questions we ask and how we use data? Or actually, are we looking and seeking for the truth in the data? So it's a difficult thing, but I think combination of strong leadership, asking the right questions, and giving the headroom and space to colleagues to respond.
And using data. Yeah. Thank you. Melissa, I'm going to come back to you and putting you on warning, Heather, you're up next. Melissa, this approach at Alder Hey was certainly very different. And I suppose the question is, how did you find the shift in thinking, and what advice would you give to colleagues? And there's a follow-on question, really. And what gave the board and the executive the headroom to do the work and not get stuck in or bogged down in the day-to-day? So those two things, if you could. Thanks.
Thank you. Gosh, I mean, the whole process that we went through really challenged my thinking, because it required us to look at the data in a different way. And I think historically, and I can only speak for HR directors, people officers in the NHS, we hadn't necessarily had issues around productivity and activity really as part of our mindset. We always thought about the workforce, we thought about the standard measures around recruitment, but I think what this did is pushed me as a HR professional to think about how do we bring all of this together and understand it. So thinking in that way was really difficult. Also, breaking out of those traditional thought processes around thinking about the workforce in the ways that we thought about them before, so by profession, as opposed to by things that united people, whether that be how long they'd worked in an organisation or which part of the organisation they worked in. So this piece of work enabled us to really just challenge all of our thinking around, do we really know what drives our workforce, what they need, and how can we then build interventions in to help improve some of those things. So yeah, it really did challenge my thinking, but it was refreshing actually, because it was different, and I could see how by focusing in on those different things, we could make some real interventions. And actually, over the last 12 to 18 months, we've seen a real reduction in turnover. We've reduced our turnover by upwards of 4%. And Naeem mentioned the staff survey scores for the NHS in England, the 61% average when they ask staff, would you recommend your organisation as a place to work? Ours was nearly 72. This year, 72%, and that put us right at the top of the acute hospital trusts in the Northwest. So we are definitely moving in the right direction, and it has been helped by us thinking differently about how we respond to the workforce and what it is that they need. So that was my first question. The second question, Joe, I'm so sorry.
Well, it's a little bit about how did people find the headspace, the headroom, rather than being bogged down, my phrase, not the other questioners, in the day-to-day activity.
I think it was that there was a motivation because we were able to present a compelling business case. And I think Heather alluded to it in her slide deck earlier. If we get this right, the impact it will have on well-being, productivity, absenteeism. So I think that gave us the lever to really give ourselves that headspace in what is a really challenging environment for us all in the NHS in England. But it was keeping focused on that goal and knowing that if we do some of these things really well, it will impact on the productivity for the organisation and activity. So it will get us all where we need to be. And having people being everybody's business and not just my business. And I think that made a real difference. And the board were committed to that.
Okay. if there's time, I'll invite you to tell us a bit about the staff advice and liaison service, because we've got a question about that. So Heather, you know, you're a big organisation, but you're part, as we are, of the system. Do you think healthcare systems should be adopting right across, whether it's integrated care boards or whole systems should be adopting this approach? And someone's rightly reflecting on what a huge organisation you are, and so there's huge opportunity. But do you think you've got the resources to do this work? Is the workforce becoming central to your organisational strategy? So system, and then back to Love.
So thank you, Dojo. System, absolutely, we need to do this collaboratively. I think we're in the midst of our business planning round, as I said earlier, and the workforce, we're doing workforce planning. We're continuing to do workforce planning in a very traditional way, based around numbers and more of the same, if I dare say so. And I think we really need to we need to turn it on its head, and we need to think about doing something different. We aren't seeing the changes that we need around workforce productivity. We don't collectively understand workforce productivity, and I believe that this work would enable us to do that. And it's, as I'll sort of bleed into the next question, in terms of the size of Luft, has a massive impact within the centre of Liverpool, but it also has a massive responsibility as well. So yes, we are fortunate that we have been able to start this work, but to continue the work, we will need the buy-in of others. And that's not just within the Cheshire and Mersey system. I think, you know, I've been talking to NHS England about what this might mean for you know, for the UK, for wider. How do we build that capability and capacity to look at the workforce in a different way? You said at the very beginning, you know, it's our biggest resource, it's our most precious resource. So we know that traditional ways of planning hasn't worked. So we need to definitely do something different. I hope that as a large organisation in Liverpool, we can help to do that, and myself and my board are committed to doing that, but we will need the support of the integrated care systems and the board to enable us to do it at scale. I think you're on mute, Dame Jo.
Sorry, thank you very much, Heather. Nadine, people are saying, okay, we've got the data, you know, why aren't we using it? And this is a big challenge, but this whole concept of a learning organisation, what are the blockers? You know, why aren't we able to embrace this concept and move forward, do you think?
Thank you, Danger. So it comes down to what I think Naeem said earlier. It's about the strength of leadership, and the leadership to be able to understand that an investment is required both in terms of time and effort to learn how to think differently. It's actually quite tough, I have to say, having worked with boards around the process of learning to think differently. So it is difficult, it takes time, but it's an effort that is required, without which you're stuck with today's thinking, and therefore today's dials, and throwing more of the same to solve a problem that doesn't get solved. So I think that's the one aspect of it. I suppose the other aspect of it is sometimes it takes a little bit of courage to actually just step away from the day job and the day way of thinking and saying, actually, you know, how do we, what do we need to do that, and who do we bring in to help to do this thinking? Because sometimes it just is a question of getting sort of challenged with your space and your time and your place. So I think that is actually a perspective. I mean, I have to say, as a medical director, when I was on boards, you know, we used to do board development. We used to have facilitation support to learn to kind of challenge our thinking, but it was often just more of the same, which was my challenge in the end as a reflection. And I guess the work we've done with colleagues at Alder Hey has taught all of us something about why this is difficult, why it takes effort, why it takes time. But in the end, as you heard from both Melissa and Heather, actually it's worth the effort, because now suddenly there's a very fresh and different view to the very people that drive the care that patients need. And I think that's the exciting bit. We can hear it now in the voices of the people that are responsible for this, which is a very different sense that I used to have. So I think for me, it's great to hear this shift.
Yes, absolutely. Someone has really challenged all of us to say, well, this sounds fine, my words, but what about an organisation that's finding it hard to recruit, hard to retain? You know, they're really struggling, and organisations are feeling under huge pressure from demand for services. So what's our experience in those organisations? What could we suggest might be helpful?
Well, I've been in 2 organisations in distress. That was kind of my expertise in one sense. Special measures. So when you're an organisation, special measures, they find recruitment really difficult.
Yeah.
Because the message is, you know, think again before you apply. And my challenge as the medical director was to say no to the person sitting in front of me if they didn't fit what we were trying to build as an organisation. To desperation to take anybody, hoping that just the skills bag was going to be enough to actually solve the problem, was the wrong approach. Then the second challenge in organizations that are very busy but actually potentially in distress and trouble recruitment is ask yourself why you're struggling with recruitment, right? Because outwardly your reputation will determine who's going to come to your organization. If your reputation is what you want it to be, you will attract the people. There are 111 questions in the staff survey of the NHS system. The only question I think that really matters is question 23C, right? Would you recommend your trust to be the one to come and work for? I think that says it all. That's the fundamental question, because if that is answered to a really high percentage, then everything else must be going well, including support, development, understanding my needs, a place where you're valued, where investments are being made, where your productivity is, you know, all those things come together. So if you're having difficulty recruitment, ask yourself why. And it may be that you're in special measures, but actually there's something bigger than that, which is what are you not doing for your workforce in terms of understanding needs and meeting those needs? Because that story spreads really hard and fast if it's good as well as if it's negative.
Absolutely right. I mean, if I may, Heather, you know, your trust has been through some tricky times, if I might describe it that way. What do you think's made the difference in terms of turning things around?
So I was just thinking, I hope you'd come to me, Dame Jo, because we have just been an organisation that's come out of special measures. We still have a long way to go, and our staff survey is still, you know, below the average in terms of our peers. But actually, we've improved the most in 7 out of 9 regionally of our scores in terms of the staff, in terms of the themes of the staff survey. Nationally, we've improved one of 5 organisations across the UK whose staff engagement score has shifted the most. Now, that's not to say I'm not pretending that we are top of the pack. We're not. We've got a long way to go. But actually, the shift change that we've made, how we've done that is really investing in cultural and leadership programmes. And looking at our leaders and why we know that leadership is the most influential part of a positive culture. So if you invest in your leaders, people want to work for good leaders. We've invested in our wellbeing packages. We've invested in, you know, culture champions. We really understand as a board that actually to come and want to work for us, we needed to do something fundamental about culture. And that's been my role over the last 12 months in terms of progressing that. So we will continue to do that on the journey, Dame Jo, but still a long way to go. What we're seeing is retention improving, better quality of candidates applying for roles, and more people applying for roles, which we've seen in the last 6 months. So yeah, not out of the woods, but a lot of progress made. Thank you.
I'm very pleased for you, delighted. So, you know, that's, you know, I'm picking up, you know, recruit to your values, be clear what your problems are, what you want to resolve, think about your leadership development program, and also how are you looking after those people that work for you, which is segueing into you, Melissa, to say a word about our sales service, our staff advice and liaison service.
Thanks, Jo. Yeah, we embarked on a service a number of years ago now, staff advice and liaison service, which we call SALS. And for those on the call who are familiar with the NHS in England, we have a kind of parallel service called PALS, which is the patient advice and liaison service. And we thought it would be a great idea to set something up akin to the PALS service that our patients and service users have, but we wanted something for staff. It's a service led by psychologists. I have a number of psychologists working to me in the people function, which is quite unusual, actually. They're not occupational psychologists, they're actually clinical psychologists who've been able to bring a different kind of thinking, I think, into the people services space, which is traditionally occupied by HR professionals, OD, L&D professionals. And that service has just grown and grown over the last few years. And it's a place where we say it's okay not to be okay. And anybody in the organisation can come to SALS. It might be that they talk to a psychologist. It might be that they talk to a member of the other team. But it's a one-stop shop, effectively, for any sort of help, advice, guidance. And we have everything from really simple queries about pay that the team will divert to the recruitment and payroll team, and they can answer that, to some of our colleagues who've presented in very, very serious distress, actually. But we've had people there who've been able to help and intervene and signpost, which is the most important thing. So it's a service that we've invested in as an organisation. We're really proud of that, and I'm really pleased that the board have supported that over a number of years. We've probably had about 10,000 contacts, I think, since we've started, and we're an organisation of 4,500 people. It's brilliantly well received, and the feedback we get about staff sharing with us, actually, we would have gone off sick if we hadn't had SALS, or I don't know what I would have done or where I would have gone if we didn't have SALS. So we're really proud of it. We won a HSJ award a couple of years ago, and last year we won the IHF award, the international awards. So some really, really great things, and we're really proud of that. But it's the foundation of how we support our staff and set up that culture to say you matter.
Thank you very much indeed. Well, we're reaching the end. I think I just want to say from the chair, look, this is really difficult. I said it at the beginning, we're still not sure where we are with industrial action. We've got huge demand for services, resource constraints. Things have to change. We simply can't keep doing what we've always done. We have to do things differently. And what I would say is that, try, I know it's hard, but, give hope and inspiration through thinking about where you want to be, your strategic focus and future, as a counterbalance to all those day-to-day things that drag us all down and are terribly important, but it is really difficult. And if today's been helpful and we can exchange more ideas, that would be fantastic. So we've got a couple of minutes. I'm going to say to each of the panel members, starting with Naeem, what is the one thing you would urge every leader to do when they leave this webinar in order to solve the workforce challenge? So Naeem, Melissa, Heather, Nadeem, in that order.
Thank you, Dame Jo. One thing, do not cut investment in workforce.
Okay. Melissa.
Get out and talk to your staff. They know what they need and what they want.
Okay, Heather.
Bring your fellow executive colleagues on board. So your chief financial officer, your medical director, all the key people that are decision makers in the organisation, bring them together and show them that one slide about productivity.
Nadeem.
Following on from Heather, the people plan is actually not a silo activity. It's something that has to be everybody's thing to work together with the CPO to make it meaningful across the organisation. But do the work to learn to think differently, because without that, the people plan will still be as it has always been.
Yeah. Well, on behalf of everyone, a huge thank you to the people who presented to us today. Thank you to each and every one of you for signing in to this webinar. There is a feedback form if you'd be kind enough to fill it in. And the whole webinar has been recorded, and there'll be a summary of the questions. So there's another one coming up soon on the 4th of June. Many thanks to everyone for their participation. I hope we've done justice to the questions, yeah, let's keep working together, exchanging ideas, because this is at the heart of what we all want to do to achieve the best possible outcomes for our patients. When we do that through a well-educated, well-informed, engaged workforce who come in and do the very best they can every single day. So thank you to everyone. I'm closing the webinar now. Thank you.